and we made some findings. Some pleasant, some are not pleasant. They're here, disturbing to us. So we have called you here as head of that ministry to clear our doubts on the questions that we got from the field. The details I think I already sent to you, but as an example, if you look at if I use the one of Arua as an example, there was a promise here in Parliament that every regional referral hospital would be given an ICU unit with 10 beds also. We went to Arua, we found that the ICU unit doesn't exist, it's not there. We also were pleased to find that there was a promise made that every district would be given money, the regional referral hospitals would be given money. The money was there, it was sent. We found that one was fulfilled. The same applies to things to do with the PPEs, things to do with the ambulances, and this cuts across Gulu, Mbarara, Jinja. So the details are here for you to give us as per the letter which has been written to you. I would like to invite you to respond to the queries which have been given to you. I'm not going to read all of them because they are there already. And as I do that, I would like to request my vice chairperson to come and sit here. He will be taking you through the meeting. I am handling another assignment also, because we are preparing for the House. There's something which I need to do in the office of the Speaker. So honourable members, thank you for coming. There are reports here to be signed also. As part of my communication, I would like to make it, request you to sign them. My colleague is competent, he's here, he's going to chair the meeting. I may join you along the way. Otherwise, you're welcome. Colleague, come and take the seat and then invite the minister. Thank you.
Thank you, Honorable Chair. Honorable members, please allow me to invite the Minister of State for Health in charge of primary health care to make the presentation to us.
Thank you so much, the Chair, and I thank the substantive Chair in absentia, who happens to be my brother from my same place. And I thank you, the Vice Chair and honorable members, colleagues, for this very important meeting. We are so happy that you've called on this meeting, the Committee of Government Assurance and Implementation. We are so happy that we are here to discuss issues pertaining activities that affect the people of Uganda. I have come along with the Permanent Secretary of the Ministry of Health. She has already introduced herself. I must first of all apologize that our team are really caught up in the Ministry of Finance, but they are on their way coming. In the next few minutes, they will be joining us. And I'm also equally saying that the presentation information is coming with them. I just ask for your patience as we, myself and the PS go along. They get us along the way. We are equally happy that you have put keen attention and interest on following up how the response and the implementation of COVID activities taking place in the country. And allow me thank you in a special way, colleagues, for the efforts you've put in supporting the Ministry of Health right from the time you appropriated and approved the budget for COVID activities. You really supported our ministry. We are very grateful for that overwhelming support. You did not stop there. You kept supporting us in all aspects, in all fields. Even in the districts, you are of very great help to us. We must appreciate your effort. And again, yet today here, this is another great support that you are offering to ensure that we are on the right track. So allow me to say that yes, we are here to give account of the implementation of COVID-19 activities following the funds that have been appropriated by Parliament of Uganda in the response against COVID-19. I'm going to give a brief and then the Permanent Secretary will also add in. But to begin with, as you all know, the funds have been appropriated and a lot of activities have taken place. We are also equally happy that you took the step to move to the region. You visited the regional hospital, you went to the field, you saw to yourself what is on the ground. That is really, really commendable. To begin with, the human resource, which is very, very critical. Everything is possible because of the human resource we have at hand. Indeed, the Ministry of Health have been given resources to recruit human resource right from the beginning. And I must thank the Permanent Secretary and all the technical team for that first action taken. To date, a total of 437 health workers were cleared to be recruited by Ministry of Public Service. And out of that, 386 were recruited by Health Service Commission. And these have been deployed by our ministry, the Permanent Secretary, to the different regional hospitals, to the emergency centers, to work on a local contract of 6 months. So we've got a total of 386 staff that have been recruited. Out of that, we have 40 epidemiologists that have been deployed. We have 23 medical officer special grades, those are specialists that have been recruited and deployed. We've got 73 medical officers that have been deployed across the country. There were 4 anesthetic officers. We have 70 nursing officers that have been deployed and 64 assistant nursing officers. We have 9 enrolled nurses. There were 3 enrolled midwives. We have 5 psychiatric clinical officers, 15 laboratory technicians, 20 ambulance assistants, 10 drivers, and 50 call center agents. So far, this has been done by the Ministry of Health. They were deployed to the regional, national hospitals, as well as emergency medical service department. In terms of monetary values, I'm sorry, Chair, if you may, with your permission, allow my team to settle.
Please.
And they give us the copies.
Well, the team could join us.
You can join us, Dr. If I the copies, you can share the copies because we're already presenting. Yeah, the copies, Dr. Sarah, you can share the copies for them. Chair, with your permission, can I go ahead or we give time for the members to share the copies?
Just a minute. Honorable members, you are receiving copies of the presentation. Please proceed.
So, thank you so much, Chair. I was just trying to read what is on the front page for those of you who have got the copy. To start with, the human resource for health, which is a very important component needed for service delivery. And you've seen with the support that Parliament has given and Government of Uganda, those are the people, health workers that have been recruited and deployed in the national, regional, emergency medical service department, as well as Central Public Health Laboratory. In terms of fund, a total of 2.448 billion has been utilized to pay this staff on contract. This includes their salaries and NSSF contributions. Chair and members, based on the current situation, there is need to maintain these staff health workers for minimum. So far we have this for the minimum of 6 months. It will take them up to, there's need to take them up to December. And that means 4.734 billion will be required for the payment of their salary and NSSF. This amount for the extension to pay these health workers for the next 6 months has not been provided for in this financial year. It is therefore important for us to note that most of these are occupying vacant positions in the regional hospitals, and we are actually recommending strongly that these people be absorbed into the mainstream of government system. Mr. Chair and colleagues, you have rightly noted issues of PPE, that is protective equipment for the health workers. A total of Ugandan shillings 10.787 billion was utilized for procurement of assorted PPEs, and these were all transferred to the national medical stores for distribution for health facilities and districts across the country. Important to note here, the normal procurement procedure has been followed according to Government of Uganda guidelines and the policy. The Ministry of Health is implementing a bi-weekly delivery system. We deliver on 2 weeks basis to the district, to point of entry, to ensure adequate supply of PPE so that our health workers have got enough to protect themselves. Orders from health facilities and districts are received through the normal procedure, the channel, the system we have. It can be a software or paper-based. And the lead time for NMS to deliver these supplies to the service delivery point continues to be monitored, and it will still stand at 8 days. A number of you have received messages on your phones as to when these have been delivered to the various facilities. We do appreciate your feedbacks on that particular issue. The regional referral hospitals have utilized and supplied and delivered according to the orders they have made. You might have found there were gaps, but I believe this has been filled, as we say, delivery is on 2-week basis. So the national funding gap for PPE for the next 6 months is according to the funding gaps, and what has been projected is 100+ billion. Number 3, procurement of intensive care beds, which the chair has talked about. We started talking of this much earlier at the beginning of this pandemic, and I'm happy to note to you that members, 109 ICU beds complete with ventilators and patient monitors have been procured, and this has costed us over 36 billion. They have been delivered. They already at the facility, they have been delivered, and by 15th of August, which is just a couple of weeks from now, the installation, training, and commissioning will be complete at all the 14 regional referral hospitals, 15 including Lacho Hospital and Bombo Military Hospital. Number 4, restoration of functionality oxygen facility in regional referral hospitals. 2 oxygen plants for Entebbe Referral Hospital and Mulago Hospital, and 450 oxygen cylinders for distribution across the hospitals were procured, and this has costed us over 6 billion, specifically 6.836 billion. The oxygen plants should be fully installed by 30th of next month this year. Mr. Chairman, I'm happy to note that these are plans. We already have plans to procure more oxygen delivery equipment and oxygen cylinders for transportation to oxygen to general hospitals and health centers across the country. The national funding gap for oxygen consumables, accessories, equipment, and consumables for hospital and ambulances stands at over 72 billion for the next 6 months. Mr. Chairman and colleagues, for the procurement of ambulances, as it has been mentioned by the chairman before he left, a total of Ugandan shillings 11 billion was allocated for procurement of 38 ambulances. The contract was signed, and this is in line with a procedure, and delivery is expected in next month. Right now, they are trying their best, the technical people, to clear paperwork and to see that these ambulances arrive safely in the country. The types of ambulance so far we have procured, out of the 38, we have type B ambulance. These are basic life support. There are 33. We've got type C, which has got negative pressure. There are 2. We've got also type C ambulance. This is advanced life support that can support even in critical condition. These are 3 ambulances, making 38 of them. Mr. Chairman, procurement of testing kits. This is one of the critical items since from the beginning of the pandemic. A total of 13 billion Ugandan shillings was allocated to procure testing kits and sample collection, as well as transportation of materials across the country. Procurement contract has been cleared by the Solicitor General for the following suppliers, as you have seen on the paper. And we expect the delivery to be in by the end of this month, 2020. The funding gap still for the testing kits and laboratory consumables for the next 6 months, up to the end of the year, stands at over 240 billion, as you can see in the report. While a total of 2.230 billion was utilized for procurement of blood bank consumable. This is to facilitate blood collection. Mr. Chairman and colleagues, concerning welfare requirement for healthcare staffs and patients, that is number 7, we've got a total of 4.213 billion that was transferred to all regional referral hospitals to cater for management of COVID-19. That includes provisions of meal and basic needs for COVID patients. That includes meals and accommodation and hardship allowance for our staff in all the hospitals, and also transportation of health workers as well as discharge of patients. And so far, we've got about 1,037 personnel that have been paid hardship allowances beginning from February this year up to June 2020. And this is, as it has been approved by the Ministry of Public Service, what we call hardship allowance for the staff that are on front line. And these staff on the front line include those working at the airport, the ones a surveillance team, those who are collecting samples across the country. We have staffs that are tracing the contacts and alerts. We've got follow-ups of suspects. Those are the list of staffs that we have paid. Number 8, Mr. Chairman, provision of transport for medical staff. This is in terms of fuel cards that have been issued to staff and hospitals to cater for transport for the essential staff. In terms of monetary value, a total of 5.948 billion was paid to the fuel supplier. Number 9, provision of meals to medical workers and patients. We've got 2.285 billion that has been provided to patients and health workers that have been actively involved in the response of COVID-19, and those are the staff as per in the statement paper. Those are the regional referral hospital at quarantine centers, and those are the border point and other staffs, including those attached to Ministry of Health as well as Entebbe Hospital. The 5 public quarantine facilities have collectively quarantined 2,000 plus residents. And these 5 quarantine facilities include paramedical school in Mulago, the Fisheries Training Institute in Entebbe, and the rest as you can see. The government supported residents in quarantine. Those are the figures which is there. Number 10, deployment of counselors in all the regional referral hospitals. I've already talked about human resource. Just to make an emphasis, COVID came with psychosocial, psychological torture. So in terms of managing comprehensively, we can't leave out the other critical care workers like health workers in psychosocial area and mental health. Number 11, provision of food and meals to quarantine persons. Institutional quarantine prevents further transmission of COVID. So a total of 2.5 billion was utilized. This is to cater for hotel bills. That was in the initial returnees quarantines in hotels. You recall many of them were in the hotels and they did not pay, so the government had to step in. Mr. Chair and colleagues, when you look at the annex on page 7, it is self-explanatory. It really gives us a summary of funding and status of procurement, right from the table, what has been procured, what is expected to be delivered. So right from PPEs and other tests. Mr. Chairman, with your permission, I will probably leave that to the members to peruse through. In case of any queries, we will be able to respond accordingly. Allow me to take you to the second last page, that is on page 11. Page 11 is giving the national funding gaps according to the categories. The funding gaps for biohazards waste management, for blood collection and testing reagents, for disinfectant consumables, for drug medical supplies, and the rest you can see it accordingly. Lastly, colleagues, on the last page, the last page is about the stock position of vital response supplies for COVID-19. As you can see, the categories of the items, the critical items, in terms of what is estimated, what is at hand, what is in pipeline, and the total. So I invite you to look critically at the surgical masks, the N95 respirators, the face shield, the protective goggles, gown, fluid resistance, examination gloves. These are open system, the Genex parts. These are testing reagents, and the nasopharyngeal strap with the transportation media. I think you can critically analyze what is on the last page. Mr. Chairman and colleagues, this is the presentation my team has come along to present to you, the colleague, in response to the letter and invitation you sent to us to respond to how far we have responded towards the implementation and how resources given are used in the fights against COVID-19. It's now my pleasure to really present and table this report to you, the committee members. I thank you, Mr. Chairman and colleagues.
Well, thank you, Honorable Minister, for that elaborate presentation. Honorable members, you have heard the submissions of the Honorable Minister. You have something to add?
No, it's okay, go ahead.
You have heard the submissions of the Honorable Minister and the team from the Ministry of Health. And I believe most of us who are out there in the field, we saw and heard. We saw and heard from the people down in the field, in the regional referral hospitals. So I now invite you to make some comments or raise your queries where you think the explanation or the report of the minister was lacking. Namisindo.
Thank you, Chair. I also appreciate the Vice clarification on the issue of staff recruited. My interest has really been that this staff that you have recruited on contract for 6 months, it would be more motivating for the staff to know that they would be taken on later, because we are recruiting them at the time when we need them. And then after COVID, we drop them. It would be really using them and risking their lives. I pray that you really take it up with Ministry of Public Service, that this staff know that they are going to be taken on and maybe posted to the same referral hospitals they are working. The other clarification I would like to get from the Minister and team is the allowance. In one message that the Minister, the PS wrote to Cow Masindi, I appreciate you ordered the Cow to pay the risk allowance for the staff. The Minister's report is talking about hardship allowance. I don't understand the difference between hardship allowance and risk allowance. In this particular case, I would imagine the staff are risking their lives to save other lives. When we talk about hardship allowance and risk allowance, I believe we are cheating the staff. As we risk them, we are cheating them. I just want to understand that. And finally, the issue of meals and transport for staff. Where we went, the staff are not satisfied with the delivery. It may not be ministry, it may be the districts, because you don't pay directly. So the conduits could be having gaps, and I would request that you intervene, because some of them had not been paid. Some of them, the movement was also very difficult. I pray you intervene. Thank you, Chair.
Thank you.
Mr. Chairman, can I clear one doubt that was raised before we started presentation on the suspect of the death of COVID-19? I forgot, just it was an oversight, to avoid again repetition of ourselves. Mr. Chairman, indeed it is true, there is a suspect, a 34-year-old female, a resident of Namisingwa district.
Yes.
He died, and the claim is that she died of COVID-19, but it is not confirmed. Samples have been taken, they are already being taken for analysis, so let's wait for the results to prove that whether it is true she died of COVID-19 or not. But for now, it is an allegation until results are out. I thank you.
Thank you, Honorable Minister.
Honorable Minister, I appreciate. I brought it up because it has caused scare in the field. And because she was a DHT and she participated in the distribution of nets, so everybody who has got a net is scared from her. And she's been working in some health center that
Thank
is
you.
in a populated trading center.
Thank you.
Thank you.
Don't pass.
Entire evening, Honorable.
Thank you so much, Chair. Madam Minister, we want to appreciate the good work that you're doing. And we still request you to blow more trumpets. Let's not enough. COVID is real, and we're still having the pandemic, but our people are relaxing, and I even see the health team, some of them are already relaxing. I'm sorry to mention that, but it's for our good. Now, while in the field, we found an issue of still on allowance. You find that in most of the health facilities or the hospitals, we have a security team, the police, that support the medical team. When it comes to time for allowances, the hospital team tells them you'll be paid by police. When they go to police, police tells them you'll be paid by the hospital where you're working from. I don't know how you're going to harmonize that. As we shared with most of them, we realized that maybe the Ministry of Health should be catering for the security that helps or supports the medical team while in as they work for our hospitals. We also realized there was a lot of stigma among the health team that take care of the COVID patients. They say once they leave the facility, they are rejected by their families. Others, the husbands are threatening to divorce them, or the wives. So I don't know what plans do you have so that these people can be received back in their communities. Things they are not patients, but they're just supporting the patients. They're not sick, but already they're being quoted. Then lastly, we have the issue of transport of vehicles. The president talked of, if it was possible, he would have 10 vehicles per district to facilitate the medical team or the response of COVID-19. Especially the district, the border districts. But there are districts that have never received any single car from the Ministry of Health. For example, Buko, you know the terrain, you know what they go through, but we don't have even one single car. We've been seeing the HE flagging of vehicles, but we needed such vehicles to support the team that are on the border side. Sorry, I'd forgotten about this. The ambulance, we wanted to know who are supposed to benefit from the 38 ambulances. Which category of hospitals are going to benefit from this, so that it will guide us. Thank you, Chair.
Thank you, Honorable Jane. Yeah, Honorable.
Thank you, Chair. I have a concern. Number 7, welfare of staff and the patients. I come from Masaka. I'm the member of parliament from Masaka district. When I visited the staff who are working on the COVID patients, the staff members, the doctors and others were complaining that they were paid once. I think that is the risk allowance. I request the minister that intervene and see, and they said they were paid little. Secondly, the patients are complaining. The 2.2 billion shillings given for the welfare would provide at least a standard meal to our patients. But I think you have also seen them complaining. You have heard them complaining. Some went to the extent of putting themselves on WhatsApp, that you can even see them to confirm that what they are complaining about is true. I also request that you investigate, find out how the welfare of the patients is. I also like to find out from the minister. I've not had any money allocated for research. And research is very important as far as this COVID is concerned. You never know. Somebody who from Uganda can find a solution to this COVID. But I have not had any amount. And I even hear that Makele was given a lot of money for research. I think it would be through your ministry to update us of how much, so that we can make a clear follow-up. Lastly, this is not about COVID, but it concerns you as a Minister of Health. There is a general outcry in the big hospitals, including Mulago. I'm planning to bring it as an issue of national importance to the floor of Parliament, that hospitals, Mulago, Masaka, Jinja, and others, they are complaining that they are no longer receiving the medicine they would wish to have for other diseases, like pressure, diabetes, sickle cell. They even went to the extent of complaining that they do not have gloves, that whenever they go to ask for, they say money is taken for COVID, money is taken for COVID. And the COVID came to stay. Therefore, I request that your ministry look into that. Despite the presence of COVID, people should be taken care of as far as other diseases, because we have malaria. The death rate has increased because now that we have put the attention, even the people suffering from AIDS, the death rate has increased because all the attention has been put to COVID-19. Thank you.
Thank you, Honorable.
Thank you, Chair. I want to thank the Minister of Health for the good presentation they have brought before this committee. Chair, I want to make a humble request. When a ministry like this is bringing to us their response like this, I pray that it must be early enough so that we can have humble time to scrutinize and so that we can raise pertinent issues. I want to tell you, like when the Honorable Minister was trying to go through the document they gave us, she could not touch other areas. And now there is no time, we cannot also go through those other areas. What if there are pertinent issues that we wanted in those particular areas? I beg next time, PS, please send us the documents very early so that we can, it is to help us and help you, and then the whole nation will be assisted when we do that together. Honorable Chair, I want to take our attention to allocation of ICU equipments and planned ones. When you look at, when you go to that page, you go to ventilators. When you look at Eastern, there is 2 ventilators allocated to, available to Mbale Regional Referral Hospital, that is in the Eastern side. Then when you come to Northern, it is 2. When you go to Western, Mbarara Hospital alone has got 8 ventilators. Then when you come to Central, it is Naguru, which has got 2. May I kindly know the criteria for allocation of those ventilators? Are there more patients in Mbarara? What is the criteria for this allocation? So that we can also, it can also help us, to guide our thinking. Because when you take the whole of Central, say here in Kampala, people travel during the day. Over 2 million people come to Kampala, come to Central. Then in the evening they go back. I believe that the allocation for ventilators shouldn't have been all in one place. I think maybe Central could be, it could be around 4. Then these other far areas, like the north, some of those places, we are near the borders, they stand very high chance of getting acute cases. This is because our neighbors are not doing well. Other neighboring countries are not doing well as far as COVID-19 management is concerned. Talk about South Sudan, talk about Tanzania. They are not doing well. So that means that the neighboring districts stand at very high, the bordering districts stand at very high chance of, having very critical people. So may the ministry kindly help me and tell us what criteria they used to allocate, those ventilators, and what is their plan to allocate in those areas which do not have. Another thing, Honorable Chair, that I would want to share with you is, border districts will always put Uganda at a very high risk, because that is area where people will always escape at night. That is area where people have got their relatives across border. That is an area where people have got common interests in most cases. So for that matter, it was proposed that the border districts are going to get means of transport for surveillance, so that we fight this COVID-19. What is happening? The border districts are not getting. But to my dismay, some of the districts are getting. Those districts which are not at the border, what is happening? Maybe the ministry can help us and explain that, so that we can know what to tell our people down there. Otherwise, everybody down there is aware that this is supposed to happen. Then lastly, my chair, about the quarantine centers. Recently, I don't come from Pakwach. I had to donate to Pakwach Quarantine Center because they didn't have anything. The people were there. Muslims were there. There was no allocation for them. Others were fasting. I had nothing to do. I had to donate for them. Really? Maybe our management of quarantine centers are not yet up to date. We need to do something. We need to ensure that really maybe our talks be reflected down there. In Yumbe, Goboro Quarantine Center, a woman almost died. This woman had ulcers. They were taken there. The food there was only, it was the posho and the beans. Then she almost died there. Please, quarantine. Yes, through you, Chair, I'm giving human information.
Thank you so much for the opportunity. The information I want to give is that they also people want to visit quarantine centers with the babies. Specifically, you find a mother having a baby of 2 months. Would love to find out from the ministry what you are doing about such people, because a mother goes there, she's breastfeeding, but the kind of attention she's given in terms of feeding, are we going to give equal treatment? There's one who cried out and asked, are we criminals? I was feeding well in my home. What did I do to be a suspect of COVID? Was it a crime? Is it a crime? Is it a criminal? And we would also love to inform you that people are crying like, first of all, most of the people in the quarantine centers are breadwinners, and the families are equally suffering. What is government doing about this? All this money that we collected as donations, all the food which was collected from here, how are you guiding government to distribute this for the benefit of the people in quarantine centers? Thank you.
For giving that information. Lastly, Honorable Chair, on social media there is some information running, and it is going viral, that the people who were brought back, say from different countries recently, these people are brought, these people are packed in very small rooms, they are crying, they are sending messages out saying that the way they are living, like there is no social distancing, the condition totally seem not to be okay. What is the take? What can the Ministry of Health say about that? Because the information going out there is not making people happy. So it will be good if we clarify that, so that the nation knows that whatever information is coming out, either is true or is lies, or is a way of trying to, damage, you see, the right thing that is done for the good of our people. Otherwise, thank you very much, Chair.
Thank you.
Thank you very much, Mr. Chair. Mr. Chair, I have 6 or 7 brief issues of concern to the ministry. Number 1, we established that there was a mother, there was a lady who gave birth in Jinja. She was positive, and that she produced, I think, on her second day in the hospital. And was it Mbale?
That was bad.
That was in Mbale. So the fate of this kid and the mother is not mentioned anywhere. We are wondering what would be the status of that kid. Time and again, we are saying we are trying to conduct a research on the vaccine ABCD. Now, here is the mother who is positive, the kid is produced when she's negative, and she's breastfeeding. What could be the status as of now? Or could that be, mother be of help as far as research is concerned? Number two, I talk about testing results. Several people have been tested. How long does it take for one to get the results? I, for one, tested on Tuesday last week. Is it Thursday here at Parliament? Today is Wednesday. It's almost a week. I have not received my results. I'm moving freely. I'm interacting with people. What if results come tomorrow and that I'm positive? How would I admit such a kind of results? And what is the effect if at all I'm positive? So I see there is a gap there. How long does it take? The same applies, the same goes to who should release these results and when, and to who. Here we have a colleague who is in Mulago. The other day it went viral that she's positive. But before she could learn of it, it was all over social media. She drove herself to Mulago. Some of us, when we read it on social media, even the speaker learned of it. One of the members of parliament, female members of parliament, is positive. The name was already in the media. They posted, her photos. Here the lady was still at home. She had not even learned about it. Who releases this kind of information to the public? Is there any degree of confidentiality in the ministry? Now the same lady is under quarantine in Mulago. The first results were not given to her. Then they took another sample. What is happening there, it's within your knowledge, but we are a bit concerned as members. The third issue is on the issues of masks. When is the ministry providing masks to all Ugandans? Of course, the masks goes with the mosquito nets. When are we getting those mosquito nets?
Information from the colleague.
Yes, information.
Yeah. Talking about masks, I remember, I think the ministry said you're making a priority, taking masks to border districts. But most of the border districts haven't accessed the masks. And the neighboring countries have masks for their citizens, but our people do not have. What do you say about that?
Thank you for that information. Maybe, colleagues, the two of you, the one who were with in Arua, there was an issue by the DHO in Arua vis-a-vis installing a regional hospital in Arua and the other district. Which district was that? Was it at Elegu? Ajumani. Yes, there are those two hospitals. Which one is central? Ajumani, there's a Ajumani hospital, right? Yes. And the Arua. Yes. Now they are saying.
Testing machine.
Yes, I think so. Yes, exactly. So there was that issue. The DHO raised it, and it is of concern. I beg to submit, Mr. Chair.
Thank you. Honorable Mola.
Thank you, Chair. I wish to thank the Minister with her team for responding to our invite. And I want to thank them for what they have done so far in taming down the pandemic.
the coronavirus. Now, Chair, I have a few issues to put across. One is on the issue of human resource, which is crucial. And I like the way they presented. It was number one. Now, I'm wondering, looking at the number that they have given to the committee, 386. Honorable Chair, we are looking at regional hospitals across the country. We're also considering district hospitals. Now, is this number 386 satisfactory? Is the ministry comfortable with this number? Because we're looking at deployment at the end of the day. How many staffs will be deployed in the different, hospitals? That is a concern to me. I know it is an emergency, but, we need to act. Honorable Chair, when we visited Gulu Regional Hospital, an ambulance that was delivered to Gulu from the airstrip, we were told, it was its maiden trip. It went and got stuck, spoiled, and it was parked there. I don't know whether the ministry is aware that that ambulance got spoiled, and people need the services of such a vehicle at this moment. And I pray that when we left as a committee Gulu Regional Referral Hospital, information was communicated to headquarters to have that ambulance repaired immediately. Because if not, it is still there parked. I don't know up to when. But according to the minister's report, there is a ray of hope that we shall be having more ambulances in the next month. As far as food is concerned, Honorable Chair, even me in my district, Apache, food, let's say beans, was never received. And most of these hospitals we visited, no beans. And that is now like a forgotten issue. And we have appear, yes, but the real beans are not there. So that was a concern to the committee. Finally, Honorable Chair, as I said, this is an emergency. Because if it is an emergency, we all have to think. We have to touch on the right buttons. As we are thinking of the patients, we should also think about our health workers. Now, in case of injury or even death, does Ministry of Health have a policy to that effect regarding the health workers? I thank you, Chair.
Thank you.
Thank you. I represent Gulu Municipality. Mr. Chair, I want to thank the team from Ministry of Health. So far, so good. We have done our best as compared to the rest of the countries, I would say, with a lot of confidence. However, there's what that we do, there are always challenges. Number one, I would love you to know that our committee is so much concerned about issues of implementation, issues of value for money, assurances that government gives and how they are fulfilled. This parliament appropriated money. I would have expected you to, at the beginning, state how much money so far you have received under this COVID situation. I say so because sometimes as parliament we can say we are appropriating money, but after appropriation, whatever happens, we don't know. So the question is, parliament appropriated money for you. Did you receive all of it? We would love to know. That should be the beginning point. Number two, There are concerns about the way you allocate resources to the various regional referral hospitals. There are those that are so busy because of the corona patients. Some are offline, they are not really so busy. But you give equal allocation. People are also concerned about the 165 million. Of course, maybe that's not directly under your control, but you are the people who guide. The 165 million which was given to districts. A district which has never had even a suspect of corona also gets 165 million. And then those who are struggling and running up and down, for instance, those who are occupying a Legu, they also get 165. They get overwhelmed. What are you doing about such a scenario in terms of being balanced? There is another issue, blood supply. Aware that the schools, the institutions have closed down, and I think the ministry has been depending on these institutions to get blood from students. There seems to be an acute inadequacy in the supply. Now that this whole thing is married to COVID-19, what is it that you are doing to fix things? Because people are starting to die because of lack of blood. What are you doing about this? You talked about money that you allocated for hotels. I think that is in Entebbe or wherever. I would have loved to see the breakdown so that we get to know which hotel got how much money. Because if you just say in blanket that 2.7 or 2.4, how do we know who received how much? Maybe they even did receive. Because ours is about implementation. It's about value for money. We have had people crying that they return, they take them to quarantine, they stay there for a longer time, they run out of the ability to pay. But here you are saying you are paying. So whom did you pay for? Whom did they pay for? Those are some of the questions that we would love to get answers to. And then the issue of askaris. It has come across the country to our notice. Those who are manning these temperature guns, actually those are frontliners. They are complaining when they are paying allowances. They don't pay them. They don't give them. Just imagine a situation where that man lays down that small tool and puts it down, and somebody who has COVID-19 crosses over. What will happen? So I think it is a very serious issue. The forces will tell us that those people have their own money from salary, but they are complaining. What are you doing about it? Ambulances that government received from the headquarters as donations. We have always heard the president saying, we need ambulances which are foreign. How come Arua, which was so busy, Arua or Gulu, was given a Tata, which failed on the road, and yet we had received all those vehicles? Why are we keeping these cars forever in Kampala, yet they are needed in these places? What is the problem? What is the problem? Because really, we want to see some kind of action. You are talking about the ICU beds. Soroti, for me, I visited as a member from the area, from the region, and it seems they don't have anything. And yet there are the cases there. What are you doing about this? Why would we take many things to a certain place and the other one, then others don't have even one? Don't you think it becomes unconstitutional? Because we shall not be giving equal opportunity to everybody. So I think these are some of the questions that we really need to answer. Otherwise, I think so far we have tried our best. For me, I think you need to be timely in terms of response. Whatever you get as resources, deploy them where they are supposed to be. Other than keeping them, you are the people who advise the president. People are crying. I thank you.
Thank you. Claudia.
Thanks, Chair, and I equally wish to join the colleagues in thanking the team from the ministry for good work done so far. Chair, my observations are few. One, I wish to implore the staff and the ministers from the Ministry of Health that this is the time that we would improve the health sector to make sure at any single moment nobody again cries about our health situation. you have a moment where everybody is ready to give you whatever you want. At this time, it's like in our village, if a student passed very well, at home you eat whatever you want. It only comes in later when you're asking for school fees, to remember when they were celebrating to slaughter whatever they slaughtered at the time because of your performance. This time when COVID has really surrounded every part of Uganda, here everything is on table and you are in position to get whatever you want. But the ministers and whoever is concerned is coming to defend the government. We are doing this, we are doing this. At the end of the day, after COVID, people will be crying and now you will also be lamenting. It's very disappointing to some of us that up to now, we still cry as to why some other health units, some other health centers are not well equipped. I was in Masaka, as these ones took the other route. Chair, we went to this other side. Masaka handles Motukula, handles Rakai, handles all those sensitive areas. But you can't find people, the frontliners who are handling the case, crying and saying we have been here for Simani 2 months, we have not gone home to serve our people, but the situation is this, some of them sleep Simani where the staff quarters are not there. 4 months down the road, I don't want us to compare ourselves to China that built the Corona hospital in how many days? I think in 2 weeks or 1 week. China. Masaka. I just requested the Minister of Health really to take a single day and go to Masaka. You will not believe that what Masaka is supposed to be is what is not. Kindly, as I saw a colleague who said, let's give attention to some of these sensitive areas. If you handle Masaka like a Kamuli, you can't tell anybody in Kamuli that they will ever have a case of COVID. No. That's why you don't see me putting on a mask. In Kamuli, it's hard to tell somebody that we shall have that case. So you handle Kamuli, you handle Buyende, you handle Kaliro, the way you handle Masaka. I withdraw the statement. Okay. Chair, let me drive my point. Because I may lose the point.
Yes.
The point I'm making, Chair, is that as we are handling Masaka, it must not be flat. We must know this is Masaka that is risky. We went to Ruchiga. Is it Ruchiga? Then they said we have a porous border here, but they had nothing. You get it? We must be sensitive. We must be cautious. We must know how to balance some of these things so that we don't again preempt a situation that we would avoid at a certain moment. So I believe, I just request the ministers and the technical team, really this time, let us use this time to make use of what we have. We were in Kavale. Kavale, the story was very different. Chair, you were there yourself. I don't want to go back into that. So I believe when we are in these situations, let us take advantage of what is happening so that we move. We saw the other day when the president was giving vehicles to some of these areas. I expected one vehicle to be given either to Masaka or Ruchiga. You get it? You'll find that I'm not talking about Kamuli. Why? I have a time when I will put Ministry of Health on pressure for Kamuli. But for the time being, the problem is in certain areas that we must prevent the disease to reach Kamuli. If we address Masaka, if we address some of these areas, the book and so on, then it will not reach Kamuli because Kamuli is landlocked. But if we open these places, then it will eventually come to Kamuli. So my concern is that for this time, let us give attention to those areas that are sensitive and we block the disease that side. Then we wait for the time when the situation will come down and we begin fighting for whatever we want. Like these ambulances, I saw a colleague talking about the 35 ambulances. I don't want to talk about the 3 because the 3 definitely are boats. So those ones will go where water is. But the 35, are they going to be distributed really, clearly? Or they will be distributed and members will come here beginning complaining that the 4 went to one place, none has been there, none has been put anywhere. So can we know really where, I was about to ask the minister to give us a list of where they intended to put the 35 ambulances. Then we are giving beds. We say these are Simani intensive care beds, Simani this. But where is the infrastructure in some of these places? The hospitals are already congested. But we want to add in some of these other things. Where is the infrastructure? The whole trip that we took in Western, we only found building of some of these structures in Imbarara. We didn't find anywhere else outside Imbarara. So what is the policy? Where is the program for the ministry to build some of these infrastructure? I don't want to be told that to set up an infrastructure, it takes a year. No. Since we are even planning for elections of 2021 and we are saying we shall still be under quarantine, why can't we also plan and say 2021 we shall still have cases of COVID? Therefore, we must have infrastructure put in place for some of these places, some of these health centers and some of these hospitals. Second last, Chair, the issue of allowances for these frontliners. These people are risking really. Why should they beg so much when we have allocated the money? Where is this money? I need to know, where is this money? Or where is the problem? Let people tell us where the problem is and we unlock that area. Who is eating the money? Who is keeping the money? Who is not ready to give the money? Where is this money? We allocate money here, people cry. We allocate money here, people cry. Where is this money? You saw a colleague talking about beans. In Masaka, you delivered the portion with the delivery note having beans without a single kilo of beans.
Even in Bali the same.
I was about to come here and really move a motion here. When we move some of these motions, our colleagues say we are being harsh, we are doing this. I was about to move a motion here. Because I was in Masaka, they said we didn't receive the beans, but the delivery note had beans. Where are the beans? And you continue having a staff there who was responsible for delivery of beans when the beans didn't reach. And we also continue coming here and you ask for money. For us, we are waiting for any other supplementary from Minister of Health at this time. Unless you bring, we continue crying for masks. You gave us 2 weeks to distribute masks in Uganda. These are 2 months. There is no single mask anywhere. Even in Masaka, I'm talking about Masaka so much because I was in Masaka, I was concerned. It has those borders. Who doesn't know about Mutukula? But we even continue begging masks here. We passed the supplementary for masks without anybody opposing. They gave us 2 weeks. We are here still talking about masks. My last question is a question, Honorable Chair. It's a question I want to ask the Minister. Minister, are you really convinced that the MOP has COVID?
Exactly.
We need an answer for the country. Yeah.
Thank you, Honorable Member. Please make it brief.
The interest of the committee to know which hotels consumed 2.5 billion for initial returnees. If anything, how many are they or who are they? Because I remember at the beginning, Entebbe Hospital, is it Grade B, had been Yamak, Mulago, and others. Where are these hotels that consumed 2.5 billion? And who are these initial returnees?
In addition, Chair, in addition to what he has just asked, we wanted to know how many people, for how many people this bill was paid for and for what period. Then what is the plan for the next returnees? Has the ministry also planned for the next returnees? Thank you.
Thank you so much, Honorable Member. Honorable Minister, there was quite a lot of submissions of members touch issues of recruitment of staff. I would like to give us a list of the staffs that were recruited and also their deployments. The 386. Who are they? Of course, we have the breakdown of the categories, but we would want to know how they were deployed, to which hospitals. And then, on the issue of masks, as the Honorable Member said, while we were in Masaka, Mbarara, Kabale, and Rushiga, we received concerns regarding the masks. Of course, given the situation and also the locality of these districts. For example, Masaka handles Mutukula, it handles Rakai, Kasensero, and the others, which are hotspots. And there were no masks. I called the Honorable Minister, Honorable Nabanja, while in the meeting, under pressure. And she told me we were loading the masks. We are loading the masks. And I informed the honorable members of the district that I have just spoken to the minister, and the minister says the masks are being loaded. And they told me, no. She told us that 2 weeks ago.
They are still loading.
We shall explain.
So I had an opportunity to interact with her fairly recently. And she told me now, finally, the loading is almost complete.
Using water,
She says that finally the loading is almost complete. Now, of course, looking at the team from the ministry, I can say it is only the PS who has so far received a mask. I don't know where the others were on the day the masks were distributed. Honorable Minister.
Yes, please.
Where were you on the day when masks were distributed at the ministry?
Chair, you want me to respond to the issues now?
Please respond.
Okay, thank you so much.
The
Chair.
issues where you can, and where you can't, you will make written
Yes, my
submissions.
members are here. Thank you so much, honorable colleagues and the chairperson. We are really so privileged that you are quite open and sincere to raise a number of issues. And I believe these are all raised in good faith to help us to streamline the fight against COVID-19. It is everybody's wish to see that Uganda has managed this pandemic in an effective and efficient manner. We thank you. Allow me convey your apology, Chair, for the late coming of my team. As I've said, the team were for another urgent meeting, 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 another urgent